Donald Trump has made headlines once again by announcing the withdrawal of the United States from the World Health Organization. This decision, made on his first day back in the White House, has sparked significant debate and criticism, particularly from public health experts. Trump's discontent with the World Health Organization is not new. Back in July 2020, during his first term, his administration began the formal process of leaving the organization. This was during the peak of the COVID-19 pandemic, a time when global cooperation in health efforts was more crucial than ever. However, when Joe Biden became president, one of his first actions was to reverse this decision, ensuring the U.S. remained a member of the organization tasked with handling global health crises. Trump's latest executive order cites several reasons for the withdrawal. He criticized the World Health Organization for its response to the COVID-19 pandemic, which he believes originated in Wuhan, China. He also highlighted the organization's failure to implement necessary reforms and its perceived lack of independence from the political influences of its member states. Trump reiterated his long-standing belief that the U.S. contributes disproportionately to the organization's funding, claiming that other countries do not share the financial burden equally. During the signing of the executive order, Trump referred to this decision as a continuation of the stance he took in 2020. At the time, he accused the World Health Organization of aiding China in allegedly covering up the origins of COVID-19 and failing to prevent its global spread. While Trump supporters back his critical stance on the World Health Organization, others have expressed strong opposition to the move. Back in 2020, lawmakers from both parties raised concerns about the decision to withdraw from the organization during a global pandemic. Prominent voices, such as then House Speaker Nancy Pelosi, called the decision reckless. Even some Republican leaders, like Senator Lamar Alexander, who chaired the Senate Health, Education, Labor, and Pensions Committee at the time, disagreed with Trump's move, emphasizing the importance of the World Health Organization in addressing global health emergencies. Public health experts have also weighed in. Dr. Ashish Jha, a former White House COVID-19 response coordinator, called the withdrawal a strategic error. He emphasized the importance of the World Health Organization in global health efforts, particularly in tracking diseases like influenza. Jha also warned that the absence of U.S. funding and leadership could create a vacuum that might allow China to increase its influence within the organization. Lawrence Gostin, a public health law professor, called Trump's decision one of his most significant actions, describing it as a catastrophic blow to both global health and U.S. influence in the world. Gostin argued that withdrawing from the organization undermines critical global health initiatives, many of which rely heavily on U.S. funding and expertise. Trump's executive order also instructed the Secretary of State and the Office of Management and Budget to halt the transfer of U.S. funds to the organization. However, the process of fully withdrawing from the World Health Organization takes about a year, and the U.S. is obligated to continue funding the organization during that period. Critics argue that Trump's actions, which aim to bypass these requirements, could lead to legal challenges. The withdrawal has raised serious questions about the role of the U.S. in global health leadership. While Trump views this as a move to prioritize American interests, experts and critics fear it could weaken international health systems and reduce the country's influence in addressing future global health emergencies. The Trump administration has reportedly extended support to help locate Austin Tice, an American journalist who disappeared in Syria in 2012. This news came from Austin's mother, Debra Tice, who spoke during a press conference in Damascus. This was her first visit to Syria since insurgents overthrew President Bashar Assad last month. However, she did not reveal any new information regarding her son's case. Austin Tice vanished over a decade ago while reporting in Syria. Weeks after his disappearance, a disturbing video surfaced showing him blindfolded and surrounded by armed men. Since then, there has been no confirmed contact or updates about his whereabouts. His case remains one of the many tragic stories from the Syrian conflict, which began in 2011 when anti-government protests escalated into a brutal civil war. Tens of thousands of individuals have been reported missing during the ongoing conflict. While the Trump administration's offer of assistance is a glimmer of hope, the challenges of navigating the complexities of Syria's conflict make the search for Austin Tice an incredibly daunting task. Donald Trump has taken a controversial step by signing an executive order that seeks to limit the legal recognition of transgender individuals in the United States. This move aligns with the anti-transgender rhetoric that has been a significant part of his 2024 campaign. The order redefines sex in federal policies as an individual's immutable biological classification as either male or female, rejecting the inclusion of gender or gender identity. This redefinition could have far-reaching implications. LGBTQ+ advocacy groups, like Lambda Legal, have already voiced strong opposition, warning that the order could restrict transgender and intersex individuals' access to critical resources. These include public facilities, school programs, and medically recommended healthcare that is readily available to cisgender individuals. Lambda Legal has also vowed to take legal action to challenge the implementation of the order. The order specifically directs federal agencies, such as the Department of State and the Department of Homeland Security, to ensure that official documents, including passports, reflect an individual's sex rather than their gender identity. Additionally, the Office of Personnel Management is tasked with enforcing these guidelines across other federal documentation. The policy also mandates a review of its implementation, which will be overseen by the Office of Management and Budget. If confirmed, Russell Vought, known for his role in Project 2025, would lead this process. Vought has been vocal in his extreme anti-LGBTQ+ stance, previously making inflammatory comments about transgender individuals, describing their inclusion in schools and institutions as transgender sewage. This executive order has sparked widespread criticism and legal threats, as activists argue it could lead to significant rollbacks in rights and protections for transgender and intersex individuals. It represents yet another flashpoint in the ongoing battle over LGBTQ+ rights in the United States, with Trump's administration pushing for policies that many see as discriminatory and regressive.